people do get an aura, a feeling that tells them a seizure is coming on, and then can prevent a seizure if they go sit down or relax or stop doing whatever they were doing.
Infant feeding by HIV-infected mothers is a major global public health dilemma. It is also a highly controversial one. The controversy is reflected in the different sets of infant feeding guidelines that have been issued over the years. And now, to breastfeed or not to breastfeed, that is the question that we are answering today for HIV-positive mothers. Well, a short while ago, I had Dr. Avron Urison from at AllLife, who is the medical director there, who shed some light on this issue.
If you breastfeed exclusively, there is a risk of obviously the baby actually catching HIV. And in fact, it's around 10 to 15% risk without the mother being on treatment. If the mother takes the correct antiretroviral treatment, which they should be given if they've gone to through the correct antenatal process, that risk can reduce to less than 1%. But there is obviously still that small risk, right? However, if the mother then chooses not to breastfeed but exclusively bottle feed, then and use formula replacement feeding, there's no risk of the virus passing through, but there's still the risk if the mother lives in a low socioeconomic circumstance, from poorer communities. Are they using the correct formula? Are they mixing up the formula feeds correctly? You know, is there contamination in the water, which can also cause about 15% of deaths that we see throughout Africa. So there is a stigma around that, and really we've got to rely on education. It's got to be education in the antenatal clinics, education actually through the healthcare programs throughout South Africa, but that actually for some women breastfeeding is okay, and for some women it's not. And it's not just